Darcy, thank you for sharing that perspective. Our next speaker is going to switch gears for us and talk about the other survivor population. So for some of you who don't recall, when the National Coalition for Cancer Survivorship redefined what it meant to be a survivor, that you could call yourself a survivor from day one through the balance of your life, whether you chose to or not material, that was not the intent. But they included under that umbrella definition family members, because they realize that these individuals travel alongside them. And we've heard caregivers mentioned, and this is a population that we're becoming more and more acutely aware we need to be looking at more closely. So again, Dr. Hedy Wald is going to talk about being a caregiver.
An excerpt from my published essay, Poised at the Abyss. My husband, Mark, called me at my practice. I've been working on something. I need you to come home now. He spoke definitively, urgently. 6 p.m., a cool evening, an ordinary day. The life before the fact. And then life afterward, irrevocably and catastrophically changed. I went for a brain MRI today. I'm haunted by the image of my precious life partner lying in the MRI chamber, already knowing the results as the scan proceeded. My physician husband, the one guiding so many with illness challenges, morphed suddenly from physician to patient in the moment of the radiologist's diagnosis. You have a brain tumor. The MD in the white coat, now in the hands of the white coats. Life as we knew it had come to a screeching halt, then trying to tread water within a tidal wave of fear and dread. I'm not a nurse, not his mother. I'm his wife, his soulmate, poised for new work projects, empty nest ready to fly, new grandson, irrelevant to the brain cancer demon, the real and surreal. Glioblastoma, aggressive brain cancer. 5 years later, against all odds, alive. 13 months chemo, 2 neurosurgeries, 2 discontinued clinical trials with nasty side effects, a current immunotherapy trial. Alive. And living a life. We treasure the good and remarkable achievements, yet there's physical limitations and lethargy and recent physical decline, frustrating for both of us. Yes, stand by your man. Even spoon-feeding him chicken soup to keep him alive as he lay on the couch with barely enough strength to get up after chemo. It is his life and our life. It's popular today for couples to use the phrase, "We're pregnant." Well, I never say we have cancer, but cancer has invaded my world as well. Indeed, we need voices of cancer caregiver survivorship is a term that I use to guide needed interventions so it won't feel like the silent scream. I'm here today to share my story because significant challenges with cancer survivorship exist for the patient and the family caregiver. There is no one representative story, but there are some common needs. I work a lot with story in medical education, but I could not have anticipated the tragic narrative turn on May 4th, 2012, the day my life ended and a new life began, the day our life exploded with my husband's devastating diagnosis. I work every day to try to reassemble those pieces into a disfigured but reconfigured life. Family cancer caregiver experience, let's face this, see our face. Caregiver distress impacts patients, and cancer-specific stress can have a measurable impact on caregivers' own physical and mental health and immune functioning. It's been estimated that caregiving stress can take as many as 10 years off a family caregiver's life. There's a loss of dreams, with an abrupt exit from what I call life in the BC years, before cancer and before cancer treatment, both with their own significant challenges, to become a stranger in a strange land, which is a book title. There's loneliness, even when not alone. For me, I needed to take a leave from clinical work to support my husband through his treatment, was sleep deprived, we heard someone speak on fatigue today, life deprived, vaporized, tried to take comfort in comfort food, became the party pooper wherever I went. How's Mark? It was as if brain cancer was tattooed across my forehead. I try to numb myself against the pain, yet stay sensitively engaged in the stuff of life, tolerating the intolerable. No one understands, I told a colleague who was also a caregiver for a seriously ill spouse. I understand, he replied. A coffee shop clerk and I shared stories of our husband's illnesses. Yeah, we tend to find each other. And she reflected on that in sickness and in health vow. No one tells you, she said, just how tough that sickness part can be. It really hurts to watch your soulmate suffer, and brain cancer is very, very scary. I would like to think with you today about supporting cancer caregiver survivorship in a multifactorial way. At individual healthcare practitioner, team, research, healthcare organization, payer system, societal levels, and what I call an SOS to rescue us, a stress offsetting system, informed by my own experience. Let's forge an integrative approach and create feasible interventions. We must and cannot play ostrich as a society because statistics on family cancer caregivers are a call to action. There are approximately 43.5 million adults in the U.S. providing care to an adult or child in the preceding 12 months in a 2015 report, and cancer was identified as the fourth main reason for which people needed a family caregiver. Estimated half of diagnosed cancer patients will be cared for by immediate family. And an estimated 75% U.S. families will find themselves caring for a cancer patient, relative, or friend at some point. Caregiving services were estimated at $350 billion in a 2007 report. At the individual practitioner level, can we be intentionally present for the family caregiver as well as the patient and help that caregiver feel heard and stay vigilant for changes in the caregiver's story which may not be so coherent and may change from visit to visit? Having our neuro-oncologist, Dr. Wen, turn his head toward me after speaking to my husband and ask, "And how are you doing?" was meaningful for me. The taking of some extra time to hear my story with authentic interest, not only about caregiving, but caregiver-centered, individualized attention about my work and other interests. Such support helped me not feel swallowed up by cancer. And the fostering of realistic hope is so helpful. Within the gentleness of staff, even the gracious valet parking attendants at Dana-Farber, you feel held. How well are we incorporating quality of life data into discussions about new cancer treatments? This impacts quality of family life as well. I know it's not about me, but it is about me too. I would call this culturally competent care in a cancer culture with awareness of patients' and caregivers' psychosocial needs. The American Cancer Society has called for education about needs of cancer patients and caregivers in the regular training of physicians and nurses. So let's raise awareness not only with patients as teachers, but caregivers too. Could we have a follow-up to the National Academy of Medicine 2008 report about patients and entitled cancer care for the whole patient, meeting psychosocial health needs of family caregivers? A family cancer caregiver should be an author. We're not all champion baggage carriers, nor are we master jugglers of care burden. Caregiving is tough. Proceed with caution on imposing a fantasy narrative on family caregivers. And Wonder Woman may be a record-breaking movie, but that may not necessarily be my story or anyone else's. At the healthcare team level, with caregivers as part of the team, how are we doing with care coordination so we don't feel so frazzled? We've had our nurse practitioners quite helpful with nuts and bolts of chemo details. Are caregiver support services and programs integrated into care so it flows? Psychology, social work support as part of the medical team depathologizes it. Needing some space to cry and express the horror is not a diagnosis. In my case, I travel alone, but I'm not a widow. I am grateful my husband is here, but it's a limited life. Support at early stages may prevent clinical depression or severe anxiety, so this is actually good for the bottom line. Help tap into strengths and boost resilience, provide resources early in caregiver websites and Facebook groups for clinical trials. I was not aware of those. I asked for a nutrition consult. Can we better integrate? I actually needed one for myself. Counsel caregivers early on Family Medical Leave Act, provide support and assistance with work and childcare and financial issues. Are phone consults available when distance or time is a problem? Offer support groups, but no pressure, because some groups don't work for all. It didn't work for me. Is there availability of art and music therapies as well as writing group? Writing can help us reclaim some of our own stories. When caring for others, it worked for me. I've published some pieces, which has been quite validating. We write into our wounds, the poet Adrienne Rich wrote. I was, however, the only caregiver in the Dana-Farber writing group. I was interested in hospital sessions on spirituality and cancer, but couldn't attend on those days and live an hour and away. So should we broaden this out with webinars and potentially telehealth? It's good to see caregivers invited to present at the brain tumor conferences in neuro-oncology at Dana-Farber. Don't ever presume there's sufficient support. With cancer survivorship, there may be compassion fatigue, even amongst caring family and friends. When the initial shock and awe wears off and the prepared meals stop arriving at the door, caregiving for a cancer patient continues, and often physical, emotional, and spiritual challenges persist for the family caregiver whose own life has radically changed, handed a new identity without a choice. Finally, have you ascertained the treatment details were understood by the patient and caregiver? At the healthcare institution level, are there enough resources for psychosocial support? Is there a caregiver hub for easy access to resources? Sloan Kettering's Caregiver Clinic gives us credibility with available therapy and a guide on their website for caregivers. A sexual health clinic is available at Dana-Farber. How are referrals accomplished when professional help is needed? And let's think about integrative medicine for caregivers. There may be group sessions at the Integrative Health Center, but what about individual sessions for the caregivers? There's a powerful mind-body connection in cancer care, but it's also true for caregivers. My husband told a staff member he didn't need a massage, but his wife, who was driving 2 hours round trip every day for his treatments, did. There's been a call for skills training and communication in addressing strong emotional reactions in patients with serious illness. So I ask, can the healthcare institution expand that training for caregivers as well? When we're overwhelmed, we may not process what we're hearing, and we may be the source of pertinent details that could be missed. And that communication training includes mindful awareness that words matter, as we've heard earlier today. The violence metaphors like war on cancer or fighting the battle might be motivational for some, but not for others who fear that may fear that they're not fighting hard enough. It doesn't always work for people with incurable cancer. Does the institution help reduce stress with review of billing before it goes out? Sufficient funding for psychosocial services and financial management counseling? How's the physical environment designed? I have found piano music and art on the walls to be soothing. And could we try using the word caregiver with some of those buzzwords out there? Patient engagement, patient experience, patient voice? The patient's voice, of course we want to hear it. The caregiver's emotional state, after all, however, affects the patients and can impact treatment adherence and recovery. Cultivating healthier caregivers can be good for the payer's bottom line and help with patient adherence and branding that institution as caring for the caregiver too. And how is the institution caring for the professional caregiver, the practitioners? Because their experience affects patients and family caregivers too, and I know the National Academy cares a lot about this. With burnout termed a public health crisis, workplace policies help cultivate a sustainable culture of resilience and well-being for the healthcare practitioners. How is the clinical trials story conveyed to patients and caregivers and the public to make it understandable, not only for ill patients, but for family caregivers? And could that impact clinical trials enrollment and success? Percent enrollment in clinical trials is relatively low. I remember signing off on a stack of paper that killed a forest of trees. It's good to see clinical trials listed, such as on the Howard University Cancer Center website. Let's be sure patients and caregivers understand the options. This diagram shows there's a triad in cancer treatment decision-making. The clinician, the patient, the caregiver, and the influence of each may change in the process. With the system moving toward more care provision at outpatient and community-based centers or at home, rather than tertiary or inpatient centers, according to Kent and colleagues in the Cancer Medical Journal, how can we ease burden of increasing day-to-day demands on the family caregivers? John Schnall of the National Family Caregivers Association reminded us the caregiver is crucial to the success of a patient's participation in a clinical trial. For the societal and payer systems interventions that conclude government agencies, private corporations, or foundations, the article by Kent and colleagues emphasized that there are unique features that distinguish the cancer caregiving experience from caregiving for other chronic health conditions. In other words, do not homogenize. Cancer caregivers typically spend more hours per day providing care, more intense care over a shorter period of time, and are often more likely to incur out-of-pocket expenses than caregivers of individuals with other chronic illnesses. Concerns about disease recurrence and pattern progression are stressful, and there's often financial stress. I read that 1 in 5 caregivers in the UK gives up employment to care. Within a life disrupted, here's a tweet on family caregivers that captured the need for practical help. Don't need crystals, mindfulness, or angels, but we need respite, services, transport, and education. How about retraining? On a national level, let's get caregiver voice into conferences and on research review panels, not only as subjects, but as authors, to help craft and answer questions such as the psychosocial needs of caregivers and the best practices, and help with understanding research. Dave Oliver wrote, "Don't take carers for granted." We have been deported from the country of the well across the stark frontier that marks off the land of malady, to quote Christopher Hitchens on the topic of cancer in Vanity Fair. So I ask, can society help bring us back from exile? There's a Hebrew phrase, refuah shlema, wishing someone a complete recovery. During a recent trip, I met a lovely couple and their young daughter. During our conversation, I explained why I was traveling alone. They were evidently touched hearing of my husband's illness. And I was more than touched when the compassionate husband said, refuah shlema to both of you, as we parted ways. I had not heard that before, wishing for my healing as well. What a gift. All of you here have worked hard on long-term cancer survivorship. Living with cancer as a chronic condition, though, means chronic stress and chronic care burden. We need an integrative effort. I conclude with an attitude of gratitude. I am grateful for my husband's courage, selflessness, and inspiration. I am grateful for his survivorship, and I am grateful for mine. As a cancer caregiver, I've written, I can do this thing, I can't. I just cannot do this thing. And then somehow, like the little engine that could, I think I can, I must. I and my entire family wish to thank our medical team at Dana-Farber and all the dedicated medical teams out there, researchers, companies like JetBlue and Amtrak, and their dedicated employees who offer seamless disability services and make my husband and me feel like human beings. We are grateful to the National Cancer Policy Forum of the National Academies of Medicine, Science, and Engineering for caring so much about cancer patient and caregiver survivorship and honoring me and my family with an invitation to speak today. Thank you, Dr. Rowland, for moderating this panel, and thanks to all the participants and all of you in the audience. You help sustain us on the toughest days. It is truly a shared humanity.